أعزائنا المشاهدين، رجعنا لكم مرة تانية في حلقة جديدة من برنامجنا علاجك في بيتك. حابين النهاردة نرحب بدكتور جويس معانا مرة تانية. أهلا وسهلا بيكي. النهاردة هنتكلم عن موضوع يهم كل الناس، وهو إنه إزاي نعالج بالمية بطريقة بسيطة في البيت. وهيكون ده عن ممكن إزاي نعمل علاج لجزء من الجسم بالمية الدافية. نقدر نسألك النهاردة إزاي ممكن نعمل ده؟
Okay, so we're talking about a contrast bath, and it's a very simple thing. What it means is to put whatever body part that you're needing to treat in hot water for a certain amount of time, and then in cold water, and then again in hot water and cold water for several times. So it's easy to do, especially if it's a hand or an elbow or a foot. And another program will talk about, if it's another body part, how we can still get the same effects but not immersing it in water.
طيب خلينا نعرف إيه هو التأثير بتاع المية الدافية على الجسم.
Well, as you remember, the hot water brings blood to the area because it expands the vessels, and so the blood comes to the area. And the cold constricts the vessels and sends it away. So in that sense, it's bringing blood, sending it away, bringing new blood, and sending it away, which also brings oxygen and takes away waste products and toxins. So in that way, the tissue can heal better.
طيب إزاي بتقدر المية تعلي أو تحسن من أداء الدورة الدموية؟
Because of the expansion. And we mentioned the oxygen and taking away waste and that kind of thing. But it also increases the white blood activity, white blood cell activity. And that has to do with your immune system. So when you have an infection and you're using this to help get over an infection, then it's actually bringing those white blood cells that will fight infection to the area, which will help you heal in a faster way. It also increases the cell activity, and so anytime you increase the cell activity, there's more healing. So let's for instance, how can we use this? We have for local infections, and we'll just do the contrast. We usually do 3 minutes in the hot, 30 seconds in the cold, and then back to the hot, and we keep the hot hot and the cold cold, and sometimes if they're normal circulation, we can increase the hot little by little because they'll feel that they want it hotter and they'll feel that they want it colder. So at least two times, I like to say at least 3 times, and then up to 6 or 7 times if you really need more healing. Also strains or sprains, like a sprained ankle. This is very good. You've already used it on your sister, and it was very beneficial to her. And even if somebody breaks a bone, the heat and the cold can help, again, heal that bone faster than if you didn't do anything. So it's very, very efficacious.
يعني مش بس للعضلات، كمان للمفاصل ممكن بيساعد.
Yes, especially arthritis. We use the heat now, and if, for instance, knees, we would use a hot towel and keep that warm or change it for 3 minutes, and then we'd put the cold towel for 30 seconds. But mild cold on arthritis because it's hard for them to take cold, but we would at least get it cooler and then back to the hot because we want that going away, that blood going away, and then coming back again with the heat.
طيب عايزين نعرف نقدر نشوف التأثير في خلال قد إيه؟
Many times it's very quickly. In a few days, you're going to see a difference. For arthritis pain, you can see it right away after the treatment. It's going to feel better, at least for a while. And that treatment can be done many times a day, as often as needed. And that's another good thing. There's no side effects from it.
Thank God.
Now, if somebody has poor circulation, which many elderly and people who have diabetes do, you can also use that on the legs and feet to bring more circulation in the area. It's just that you have to be more careful about temperature. Not too hot, not too cold. but still a contrast, so it'll still have the same effect.
يعني أعلى درجة حرارة ممكن يتحملها الجسم وأقل أو أبرد درجة حرارة ممكن يتحملها الشخص.
Right.
طيب عايزين نعرف أكتر إزاي هنعمل ده.
Yes, that's the next thing, isn't it? We want to know how to do it in a way that's going to be beneficial for the person. So we've said this many times, but temperature is very important. You have to check the temperature before the person puts their hand, foot, or whatever they're going to put in there. Make sure it's not too hot. And then for the cold, it should be cold enough that ice won't melt in it. And what we do, we keep adding ice to the area so it will be cold enough. This is a normal person. If it's somebody with compromised circulation, I would not have the ice, but I would have it more mild, the cold more mild. And then, as I said, we gradually increase the temperature of the hot and gradually increase the temperature of the cold, because by then the person who's having the part in the water will feel the need of more hot. They'll say, oh, this is too cold, I need more warm here. And this is feeling warm now, I need more cold here. So they will actually feel the need for that. And then to look at the person and see how they tolerate it. And sometimes these treatments, if they start to sweat, then we want to have a cold towel available to put on their forehead so they can stay in a good temperature themselves.
في مرات سابقة حضرتك قلت لنا إنه ممكن حد يكون عنده أمراض زي السكري أو ضغط، فما بيقدرش يميز قد إيه السخونة أو يقدر يشعر فعلا بالدرجة الحقيقية للمية، فكيف نقدر إحنا نحدد له درجة حرارة المية؟
Then it's good if you have a thermometer that you can actually check the temperature of the water. And it shouldn't be any more than, to start out with anyway, any more than 39 degrees, maybe even less. Maybe start at body temperature and then gradually move up because of the compromised circulation.
يعني أقل شيء نبتدي ب39 درجة الحرارة ونقدر نزود مع الوقت.
I would start at body temperature for those people and then move it up to about 39 or 40 as you can see that they tolerate. Because you will be checking it too with your hand. And if it's too hot for you, it's too hot for them.
وبالنسبة للشخص العادي ممكن أعلى من كده درجة الحرارة.
And they will tell you, I need more hot, it's feeling cool. And so they're a good guide to how much heat to add and how much cool to add. Again, we went to some of the precautions are what we just talked about is people with compromised circulation. Also, if there's any chance of hemorrhage in the area, you don't want to use hot. And also, if there's a malignancy, we would always want to check with the doctor to see if it would be fine to do this or not.
Or any أو لو كان في عندهم أي جروح أو شيء في الجلد أو إحمرار.
You know, even if there's an ulcer on the skin, like a lot of people who have compromised circulation can get ulcers on their skin, it's okay to use the hot and the cold. It's just that we want to make sure that the equipment, well, for anybody, that the equipment is sparkling clean and it won't spread infection. And then afterwards, we would want to clean it very well so nothing could spread. But even a sore on many people with diabetes, you can help their circulation, and even if they have a sore like a toe, it can help the circulation so they won't have to lose that toe. So it's still very important.
طيب خلينا نعرف إيه الحاجات اللي ممكن نحتاجها علشان نعمل علاج بالمية.
Well, you know, when we have our model here, I think we'll talk more about the equipment because you'll see it. It'll be easier to remember. But we can move on to how do we actually do the treatment. We've talked a lot about the precautions. But first of all, you want the room warm and no drafts. No windows open, no doors open. So that's the main thing that we want to do. We want to explain it well to the person so they know what we're doing and why. And we want to pray. And because we know God is the healer. And not this treatment, but he's given us means to assist in the treatment. And of course, begin with the hot water. We've said that. And after 3 minutes, we put the part in cool water. So I think as we go along, you're going to see it's very simple, and as we're doing it, I think we'll explain it a little more and it'll make more sense. Okay, we have a good volunteer today, Miss Amr. She's going to be helping us, and although she doesn't have any problem with her hand, we're going to pretend that she needs to treat her hand, okay? So this is the warm water. I've tested it, and I think it will be okay for your hand. Just pull your sleeve up a little bit so you don't get it wet, and you test it and see how it is for you. Put your hand in it. Yeah. Is that enough? Hot water?
No, it's okay.
It's okay? Does it need a little more?
No.
Okay. So Naveen is going to help us with timing this. So we want to keep it in the hot water for 3 minutes. Now, if there was really a problem, I would start with the water a little higher to cover even her wrist. But we will be adding more hot water as we go. So I wanted to leave some room for the hot water to come in. So why are we doing this? The hot water is going to bring blood to the area. And as we go along, you'll see her hand getting redder and redder. And then we want to send it away because we want a place for the new blood to come. The blood now is bringing oxygen and nutrients to the area. So when we plunge it into the cold water, it's going to chase that water away. It's going to constrict the vessels and send the blood away. And then we'll put it back in hot water. And then we will bring the blood back. And we usually pray before we start a treatment. We didn't do that yet, so I'm going to do it now. Okay? Dear gracious God, we thank you for the simple treatments that you've given us that are so beneficial to us, that don't take any money, that are easy to do, and that anybody can do it at home. So we ask that you bless this treatment. Bless Amr. Thank you for sending her to help us. And we ask that you bless me as I help her with this treatment. These things we ask in your holy name. Amen.
Amen.
So how's our time now?
1 minute and 15 seconds
Left.
left.
Okay. So when she... Oh, sorry. Go ahead.
حابين بس نعرف مشاهدينا الأعزاء إنه دكتور جويس دلوقتي حطت إيد قمر في المية الدافية حد ما هي تقدر تتحمل، ولمدة 3 دقايق راح نغير المية لمية باردة حتى نعمل تباين ما بين درجتين الحرارة، وده هيكون عامل مساعد لأنه نحسن من مستوى المناعة للجسم.
So when we send the blood away, then it makes room for more blood to come back. And so when we put it in the hot water again, then it's good and brings it back. Now there are many areas that we can do this. The hand is an easy one. If there's a problem with the elbow, you can do that. If there's a sore joint on the elbow. We can also easily immerse our feet. And when we do the feet, we usually like it up to the ankle. And for some people with bad circulation in the legs, we can have even an area where we can put their whole leg in up to the knee.
We're up.
We're at 3. Okay. 3. See her hand is still red already a little bit.
Yeah.
So we're going to put it in cold for 30 seconds. Does that feel like it's too long, 30 seconds? Now, while she's doing that, let's heat this up a little bit, just a little bit. And let's stir it around. That's good. Okay.
I think we'll be cooler until she finishes.
Okay, that's almost time.
4 ثواني.
Excellent. Now just test this yourself before you put your whole hand in. Is it okay? Okay, so put most of your hand in it as you can. That's good. I'm going to add a little more cool to this one. What we want to do is keep the hot water hot and the cold water cold. And like I said before, as people are doing this, they're going to feel the need of hotter water over here and feel the need of colder water here. So I've 3 more minutes. Now, how many times do we do this? I like to request people to do it at least 3 times. And you can do this several times a day. If you have a bad infection, you're going to see it start to heal maybe the same day. So that's a very good thing. But if you have more time, if you can do it 4 times, 6 times, even up to 7 times, it's very beneficial. So, how's our time? 2 more minutes, 2.5. Excellent.
طيب نقدر نستغل الوقت ونسأل حضرتك إذا كان المية بتعمل إبعاد لكرات الدم، وفي نفس الوقت لما بنحطها في مية ساقعة تاني بتعمل إرجاع لكرات الدم فبتحسن الأداء الوظيفي. إيه تاني ممكن تعمله المية الدافية والمية الساقعة بالتباين؟
Well, those are hot and cold water are one of the best things to do. If you're talking about other ways to add the fluid, because we can do hot packs and cold packs to joints and things that we can't easily immerse in the water. So that's another way we can do it, and we'll be showing that in a program as well. So that'll be good. I just want to tell you about someone that had poor circulation. He was diabetic and had it for years. And he came to a center where they do these kinds of hydrotherapy treatments. And they did several things for him, but one of the things they did was to use this kind of treatment, the hot water, not too hot for a diabetic, and the cold and the contrast. Now remember, he couldn't even feel his feet. It was very difficult for him to even walk because, you know, when you can't feel where your feet are on the ground, it's very difficult to walk. So as time went on, he was there maybe 3 days, and he said, you know, I can feel my feet now. And that was a big thing for him. It improved his circulation so much that he could actually feel his feet and walk better. So this is very, very good treatment for many things. Yeah. So I'm almost ready for the cold. We still have some ice floating in there, so I think it's going to be cold enough for you when you put it in. And if you want to leave it in the hot water longer, 4 minutes, 5 minutes, it's fine. It depends. But we're using 3 because that's at least, you should have it in 3 because you want that part very warm. So that's your signal to put it back in the cold. Good. And let's see, we might need to add, yeah, a little more hot water. Mm-hmm. Now, when you're adding hot water, make sure that their hand or foot or whatever you're treating is out, or at least to the side, so that you can keep it away and stir the water and not have it touch the part, because we don't want to burn anybody. So that's the basic precaution here, is make sure you don't burn. Okay, now just test that again yourself. And see if it's okay. All right? Okay, excellent. So we've done 2 changes now. This is the 3rd one. So this is good.
ايه الأخبار؟
You know, there was a time when I had an infection too in my hand, so it's easy to treat, and it really helped it heal very fast. And so it was just really good to know I didn't have to go to a doctor, I didn't have to have antibiotics, I didn't have to do any of those things. I just treated myself with hot and cold water, and the infection went away. And alhamdulillah, I was okay. So it's something you're going to find so useful at home, because anytime you get a cut, it can get infected if you don't take care of it properly, and so many ways you can have an infection, or even if you have swelling. This helps for swelling. So swelling on the ankles, too hot and cold. It's amazing how that can decrease the edema and make you feel like your feet feel good again.
كويس انه نعرف كمان انه التباين ما بين المية الدافية والمية الساقعة بيساعد كمان على التورم انه يقل ويحسن من اداء الاوتار فيما بعد او العضلات كمان.
How's our time?
Pretty close. 1 more minute.
1 more minute. So I think this will be good. We'll just do this last change, and that means that we got 3 changes in. So that's sort of our minimum. And thank you, Amr, for being with us. But when we take it out of the cold at the last, we're going to show you how pink her hand is. So remember, it's bringing the oxygen, bringing the nutrients, and then the cold, it's taking away all those waste products from, all of our cells. When they work, they have waste products. They're like a little factory. So factories have waste products they have to get rid of, and so do our cells. So it takes away waste products, any toxins, and allows the new blood with the new nutrients to come and replace those. Okay, it's almost time for the cold. I think you can put it in now. Last time. For 30 seconds. And so it's very simple. Anyone can do it. I'm sure you can do it at home. And remember, one of our assignments was for you to take a contrast shower. Hot shower, get nice and warm, and then end with cold. So it's very similar to that.
تقريبا انتهينا من الجزء العملي اعزائنا المشاهدين، ونحب نقول لكم قد ايه كان سهل وبسيط نقدر نجهز ميه دافيه او ميه سخنه والميه ساقعه بالثلج، ونقدر نعمل علاج طبيعي وبسيط لنفسنا في البيت او لاخرين بيشعروا بألم في ايديهم او في مفاصلهم. كنا سعداء معكم، واتمنى ان احنا نكون استفدنا من المعلومات القيمه والتجربه العملي اللي جربناها النهارده، ونتمنى نشوفكم في حلقات تانية ان شاء الله.